So people over the age of 60 are expected to start getting their COVID-19 vaccinations as soon as the second phase of the vaccine drive gets underway. Close to 400,000 people have registered since the online portal was opened. And as the country gears up for the vaccine rollout, the South African Medical Association, SAMA, is advising all those over the age of 60 to get the flu jab as soon as possible ahead of them receiving the COVID-19 vaccine. To tell us why, the national chairperson at the South African Medical Association, Dr. Angelique Coetzee, joins me now for that conversation. Doc, you are saying as SAMA you strongly encourage, and it is a good idea for people over the age of 60 to get the flu jab before getting the COVID-19 vaccine and allow 2 to 3 weeks of a gap between the two vaccines. Why?
Thank you, and thank you for asking our opinion, and again a good morning to all your viewers out there. So the flu vaccine, it is important to understand that the vaccine itself takes about 2 to 3 weeks before it starts to give you protection against flu. So, and you should actually get it on the right arm, so that when you get your COVID-19 injection, that normally is on the left arm, so that you make sure that if there's any soreness of the arm, if it's not more than 3 weeks apart, that you know which vaccine was causing it. Why do you need this vaccine, the flu vaccine? We know that if you look at the data, flu is also a killer of people. It's not only for the 60s and above, but also increased hospitalization rates for young children, especially under the age of 5. So you want to protect the young children that can bring it over to the elderly people who sometimes look after them. And you want to protect your elderly people or your 60-pluses. I don't like to use the term elderly because I'm over 60 and I don't feel like an elderly. So, so for people 60 and above, so that they are protected. You cannot afford to get severe flu and then also COVID-19 on top of it. That would be a recipe for a disaster. You would really struggle to get out of a hospital if you get both of them. So you need to get your vaccine, your flu vaccine. Again, as we have said, it takes about 2 to 3 weeks. It gives you time, as the COVID-19 vaccines will be starting to roll out middle of next month. So it more or less gives you that window period of 3 weeks to 4 weeks before you get the COVID-19 vaccine. Also important to understand, COVID-19 vaccine, especially the Johnson & Johnson one, will take 28 days before you get immunity from COVID-19. So if you look in totally between the flu and the vaccine, you look at about between 6 to 8 weeks nearly before you are fully covered. By that time, we are really in the midst of winter. So you have to do the first one now, so that when your chances are there of getting the COVID vaccine, we know that's the last vaccine that you need to get for this year.
But Doc, your recommendation for people over the age of 16 to get the flu vaccine first before getting the COVID-19 vaccine, is that a generic good practice recommendation, or is it based on a link, you know, how the two vaccines land up and operate in the body and in the immune system? Is there something specific there, and perhaps even issues of side effects that you are seeking to deal with? Or are you just saying that it is good practice to get your flu jab because influenza remains a killer of people?
It's good practice. And while you now have the time to, you know, because the vaccine is still not available for phase 2, it is the ideal period, window of opportunity to get your flu vaccine now, so that, again, when next month comes, that's already done and dusted. So also please understand that if you look at your COVID-19 vaccine, if you get it, again, there you have to wait. Let's say you haven't taken the flu vaccine, and you then decided to first get your COVID vaccine. You will then also need to wait 3 weeks before you can get the flu vaccine. Now, if you again look at time, by the time the the COVID vaccines are available for the public, again, mid-May, and if we're lucky and everything works out perfectly, we will be finished by middle of June or the end of June. But then to go and start to say, I then want to get a flu jab, it's a bit late in the season then. You need to get it early. The ideal time normally for flu vaccines is around about March. So that's why please take it now, so that when the vaccines come, you're already past your window period of waiting for the vaccine.
Sure. And I know that it's a question perhaps best left for pharmacists more than yourselves, but you are perhaps able to talk to it. Flu vaccine availability is always a big talking point, right? Because, you know, you start just on the edge of the flu season, you are encouraged to get a flu vaccine, but, you know, you'll go from pharmacy to pharmacy and just basically be told that they are out of stock. What do you know about that particular issue?
So, yes, we got it late. Most of the pharmacies only started to alert their clients beginning of last week to come and get the flu vaccine. So the flu vaccine program, you know, in the private sector only sort of kicked off last week. For now, there's still enough stock. But going forward, if you sleep, and you're then, and in about 6 or 8 weeks from now on, wants to go and get the flu vaccine, you will maybe end up without having getting stock at any of the pharmacists. That's normally a problem, and I don't know why we every year sit with the same problem. And this has got nothing to do with National Department of Health. This is a private a problem, and it's a problem between the wholesalers and the manufacturers. I'm not sure why this is happening. And I did address it with National Department, and they have enough stock, but they do not have any jurisdiction on the private sector side. So again, go and get your flu vaccine, especially above 60, and then for the younger children, with the new vaccine that's currently on the available. Just want to show you, this is the Influvax Tetra. This is what is currently available. The same dosage for adults and for children. And it's got a 4-strain vaccine against the viruses for this year. I myself got one. It's not really painful. And again, on the different arm, then I got my COVID-19 vaccine. And again, no side effects. But if you're, you know, some people will tell you that, you know, I get my flu vaccine, the next day I've got a bit of body aches and pains. You're welcome to take Panado or Brufen. There's a lot of the side effects that you will experience with your flu vaccine, if experience side effects, will be more or less the same with the COVID-19 vaccine. So again, it's better to wait your 2 to 3 weeks in between the 2 vaccines before you get the follow-up one.
All right, doctor's orders. Thank you for that, Dr. Angelique Coetzee there with sage advice, particularly for people over the age of 60. As you are registering on the electronic database of government to receive the COVID-19 vaccine, Dr. Angelique Coetzee and the good folks at the South African Medical Association are advising that actually just get your flu jab done as soon as possible before you even get the COVID-19 vaccine when it's rolled out under phase 2. And she does say that it's just a matter of good practice. They're not seeking to link the 2 vaccines in any way in terms of how, you know, it plays out in the immune system and how it affects the body.